Good afternoon and welcome everyone to Madison VA's live Teletown Hall. Our leadership is excited to connect with women veterans today. My name is Teletown and I serve as the Women Veterans Program Manager here at the Madison VA. I'll be moderating this afternoon's call. Thank you so much for taking the time to join us. We have a panel of Madison VA leadership on the line along with staff from mental health, whole health, community care, primary care, and several other areas to help answer your questions. Over the next hour, we'll share important updates, including updates on Women Veterans Self-Defense Class, weight management, Women Veterans Recognition Day, and more. Between these updates, we'll hold live question and answer sessions. If you'd like to ask a question, simply press 0 on your phone at any time. A staff screener will take your question and place you in the queue to speak with our panel. We encourage you to stay on the line and participate. If we don't get to your question during the call, you'll have the opportunity to leave us a voicemail at the end so we can follow up with you. Please note, if for some reason you can't stay for the whole call, we'll also post this call on our website over the next week or two. Now I'll turn our call over to our Executive Director, Christine Kleckner, for opening comments.
Good evening. We are truly honored to have you with us this afternoon for our Women Veterans Teletown Hall. Thank you for taking the time to connect with us. Today we'll be sharing important updates, listening to your questions, and hearing what matters most to you. At VA, women veterans belong. Your service, your experiences, and your health needs are at the center of everything we do. You deserve care that is safe, respectful, and designed specifically with women veterans in mind. Our commitment is to provide an environment where you feel heard, supported, and confident in the care you receive. We take a whole health approach, recognizing that well-being includes physical, emotional, social, and mental health. When you enroll with VA, you gain access to comprehensive care that supports you throughout every stage of life. This includes personalized services that honor your goals and empower you to live the life you want. Thank you again for joining us today. I look forward to your questions and to the opportunity to engage with you during this important conversation.
Thank you, Director. Next, we have updates from several of our programs. Our first update is on fertility care. Did you know that all veterans are automatically eligible for VA fertility benefits? That's right. If you've ever wondered about fertility care, VA has resources for you. VA offers some basic testing, but most fertility care is provided through an in-network fertility clinic in the community. To get started, all you need to do is talk with your VA primary care provider and ask for a community care referral. These benefits cover a lot: your initial consultation, comprehensive testing like labs and imaging, procedures, medications, and certain treatment options. And here's something important. If a service-connected disability is the cause of infertility, you and your legal spouse may also be eligible for in vitro fertilization and cryopreservation storage benefits through VA. If you'd like to learn more, contact your primary care provider or reach out to our fertility care coordinator at 608-256-1901, extension 18584. Again, that number is 608-256-1901, extension 18584. We're here to help you take advantage of those benefits. Next, we have Karen Balke with some updates on weight management.
Madison VA is proud to offer a variety of opportunities to support weight management. Weight management is a priority for many veterans, but it's important to recognize that it is highly individualized for each person. We offer non-medication options, such as the MOVE and nutrition programs, which can help you build the lifestyle skills needed to meet your weight management goals. Medications may be an option for patients who qualify. Please note that while medication therapies are available, each has prescribing considerations. Even though you may see many advertisements for medications, it's important to remember that not all medications are available to patients based on national prescribing standards, pre-existing conditions, and available medication supply. For those interested in learning more about what opportunities may be best for you, we encourage you to reach out to your primary care team for additional discussion. If you have specific interest in learning about weight management medications Engagement with the MOVE program is required prior to prescribing any weight management medication. MOVE is a wonderful opportunity to seek engagement with this team of motivated care partners as a first step toward your weight management goals. Some of you may ask, why can't I go directly into taking medication instead of participating in the MOVE program? Medications work best when added to healthy eating and activity instead of a standalone approach to weight loss. Medications also aren't safe or appropriate for everyone to use. MOVE helps you build the lifestyle skills that make any future medication safer and more effective. And it sometimes leads to enough progress that medication is not needed. To try the MOVE program, contact your primary care team and ask for a referral to MOVE. You can also call our nutrition clinic at 608-256-1901, extension 17387, to learn about upcoming classes and enrollment options. Again, to participate in the MOVE program, contact your primary care team or call our nutrition clinic at 608-256-1901, extension 17387.
Thank you, Karen. Our next update is on our Hall of Heroes here at Madison VA. We're excited to induct our next Hall of Heroes veteran next Friday, May 22nd at 11 a.m. in the hospital auditorium. If you have 30 minutes to spare, please consider joining us as we honor U.S. Army Staff Sergeant Thomas Hack, who served in Vietnam, earning a Bronze Star and a Silver Star for gallantry in action. Hopefully you can make it. Again, that's next Friday, May 22nd at 11 a.m. We also want to encourage you to nominate a hero you may know for consideration for our next round of selections for our Hall of Heroes. If you or a veteran you know served in conflict or wartime, received military awards for valor or specific combat actions, and you currently or would have been eligible for care at the Madison VA Hospital and Clinics, we encourage you to submit a nomination. You can find out more information by searching online for the Madison VA Hospital Hall of Heroes. 2 years ago, we also created our Purple Heart Hall of Honor. So if you or someone you know received a Purple Heart, we encourage you to learn more and consider submitting a nomination. The deadline for this year's selection is June 1st, so you still have a few weeks left. Search online for Madison VA Hospital Purple Heart, and you should find more information. Thank you, Maddie. Next, I want to share some exciting news about a new opportunity coming to Madison VA. We are preparing to offer a basic self-defense course specifically for our women veterans. This training will use the RAD system, which stands for Rape, Aggression, Defense, which is one of the most widely respected self-defense programs in the country. RAD focuses on awareness, prevention, risk reduction, and practical physical defense skills. It's designed to empower women by giving them options, confidence, and hands-on techniques they can use to protect themselves. 2 of our female Madison VAPD officers have completed the official RAD instructor certification, so we can bring this training directly to our veterans here at Madison VA. Our goal is to help women veterans feel safer, more confident, and more connected to their community. This is a full-day course with a max of 12 women veterans per course. There will be both lecture-style learning and hands-on practice. Lunch will also be provided. The first self-defense training course will be held on Saturday, August 8th, 2026, from 8 a.m. to 5 p.m. at the main hospital. Again, that is August 8th, from 8 a.m. to 5 p.m. This is the first we are mentioning this publicly, and we will start advertising widely very soon. So if you would like to sign up, please RSVP with Shanna at 608-256-1901, extension 18422. Again, the phone number to RSVP is 608-256-1901, extension 18422. Don't worry if you're not able to attend this first course, as we plan on having future courses offered, and we can put you on a waiting list too. Our next update is on whole health from Sarah Rogers.
I'm Sarah Rogers, the Whole Health System Coordinator here at the Madison VA. One of the things that truly makes VA stand out is our commitment to a whole health approach to care. And when we say whole health, we don't just mean something that feels good today or a nice optional add-on. We mean a robust approach to healthcare that starts with you. What matters to you, what you want your health for, and what kinds of support will help you live the life you want. One component of the whole health approach is the integration of health and wellness services that can help you to build lifelong skills and live a meaningful life. What's exciting is that the whole health system of care doesn't just sound like a good idea. It's backed by national research showing real and measurable results for veterans across the country. For example, veterans who use whole health services are more likely to talk with their providers about their personal health goals, and over time, they report better mental and physical health. We also see significant positive changes in pain management. Research shows that veterans who engage in a whole health care approach report meaningful reductions in pain interference and are far less likely to need invasive pain procedures. Many veterans are also able to reduce their medication use at rates noticeably higher than those not using whole health services. We see improvements in other areas too. Veterans who combine whole health approaches with their mental health treatment are more likely to complete their therapy programs. And for chronic conditions, like high blood pressure or diabetes, veterans who participate in whole health are achieving better control of those conditions compared with veterans receiving traditional care alone. All of this tells us something important. When we center care around the whole person, your values, your goals, your strengths, and provide you with the tools you need, it leads to better health outcomes, not just in theory, but in real data from thousands of veterans nationwide. So when we talk about VA health, whole health care at the VA, we're talking about care that empowers you, supports you, and is proven to make a difference. And that's something we're incredibly proud to offer every veteran, including all of you joining us today. If you're interested in learning more about whole health and connecting with the Madison Integrative Health and Wellness Team, you can call 608-256-1901, extension 12537, and ask for an introduction to whole health. That number again is 608-256-1901, extension 12537.
Thank you, Sarah. Next, we have Ann, our Women Veteran Peer Support Specialist, here to provide an update on our Women Veterans Day recognition.
Thank you, Tim. Women Veterans Recognition Day is not a separate Veterans Day for women. Instead, it commemorates the signing of the Women's Armed Service Integration Act on June 12, 1948, the law that granted women the right to serve permanently in the regular armed forces. There is a rich and powerful history of women who have served in America's wars and conflicts, and it's important that their service and sacrifice continue to be recognized. When women leave active duty, they should feel welcome and supported at the VA, knowing they belong here. To honor our women veterans, each of our clinics and the main hospitals will host a recognition table featuring women's health resources, cookies, coffees, and members of our women's health team who will be available for questions, support, and celebration. From June 8th through June 12th, staff will be present with cookies and coffee from 9 a.m. to 11 a.m. at the following locations: June 8th at the East Clinic, June 9th at the Freeport Clinic, June 10th in Janesville and Baraboo Clinic, June 11th, West Clinic, June 12th, Beaver Dam, Rockford, and at the main hospital. Again, at each site, we will offer resources, cookies, and coffee from 9 a.m. to 11 a.m. Additionally, each location will have a Women Veterans Resource Table and signage available throughout the entire month to honor Women Veterans Day.
Thank you, Ann. Now let's go to a few questions from all of you. To ask your questions, press 0 to speak to one of our operators. All right, we have Deborah on the line from Baraboo. Deborah, what question do you have for us today?
Well, my concern is primary care physicians. I know that a few have left, and mine that I had for over 12 plus years left because she wasn't able to continue serving the veterans the way she thought was needed. And I noticed that when I was told, okay, you're going to see so-and-so now, I did my research and found out she didn't like service dogs or didn't like dogs. Well, I'm not leaving my service dog at home because a doctor doesn't like dogs. So I requested a change. And it was like twisting arms to try to find somebody else. When I did, I was told, I figured it out in my first visit because I do suffer from anxiety, PTSD, and other things, that I wanted a video appointment. And during that appointment, I realized that, yes, she stuck to a 30-minute time limit period. It was our first visit. I expected her to know my file with her taking it over, and yet she knew nothing about me. And it frustrates me to know, one, she's not Women's Health, she's just a doctor, which is fine. I haven't had Women's Health issues in years. But it gets frustrating when, after so many years of being seen by a doctor that respects you, takes the time to listen to you, help you solve your issues, get you to the right people. When I asked this doctor about a headache, oh, well, we're out of time. I've been having headaches for 8 months and can't figure out why. The eye doctor says it's not my eyes, but yet she tells me she's out of time. That's ridiculous. Women are the same as men when it comes to health care. Take care of us. We did our time, and we shouldn't be brushed off just because you're on a schedule due to the new government regulations. If it's your first visit, you should have scheduled us for over an hour, not a half hour. And it's getting frustrated to even come back to the Madison VA or the East Clinic because I don't know how I'm going to be treated.
Hi, Deborah. This is Dr. Marsh. I'm the Chief of Staff. I'm truly sorry to hear that you had that experience. That is not what we're about here at the Madison VA and our surrounding CBOCs. It sounds like you did not have a good experience with one particular provider. I know there are a lot of outstanding providers out there, and perhaps you caught this person on a bad day. I'm not trying to make excuses. I'm just saying that maybe that's what it was. You can certainly request a different provider, and that will be something that would go through the primary care department. But if you leave your information at the end of this call, we'll have someone follow up with you to see how we can navigate this for you, okay? And I definitely want you to get your headaches evaluated. That's not something we like to leave unexplored. So that's something that I definitely want you to leave that information so we can follow up, okay?
Well, to be honest, I talked to a counselor 2 days ago, and she sent a message to the scheduling person to schedule me with my doctor, whoever it is, because my headaches have not been solved. Within 4 hours, I received a phone call scheduling me for an appointment.
Oh, okay.
But I don't like having to pull teeth and have to tell every swinging person around me that I'm not comfortable. I don't know if that makes sense, but
Yeah, no, absolutely.
I have a lot of issues.
Sure.
And people need to know those issues for when I walk through that door, because if they set off those issues and I'm already all the way down in Madison and they set that issue off, I still have to drive home. My chances of making it home could be very slim. So they have to understand me. I don't know if that makes sense, but that's the way I feel.
You bet, absolutely. And again, leave your information. I want to make sure we get some follow-up with you, okay?
All right. Thank you.
And all of you, this is Jim from Public Affairs. Just a reminder, everybody on the call, if you have a question that goes unanswered or you need to leave a detailed message at the end, everybody will be able to leave a voicemail, and we will get back to you.
Thank you, Jim. Next up, we have Robin from Rockford. Robin, what question do you have for us tonight?
Hi, I'm calling about the whole health yoga class that we were having in Rockford at the VA clinic. When is that going to start back, if so?
Hi, Robin. This is Sarah. Sarah Rogers with the Whole Health Program, a social worker and program coordinator. The short answer is I don't think we're going to have on-site yoga at the Rockford Clinic anytime in the foreseeable future. As you're probably aware, we have a lot of options online, and actually the staff member who taught that yoga class in person in Rockford has a group that she teaches online regularly. So it just is a reflection of our resources that we found we can reach the most veterans in the most geographic locations by bringing our live classes onto video platforms. There are a few exceptions. You might be aware there's a in-person Tai Chi class at the Rockford VA, but in general, yoga, meditation, Tai Chi, these offerings really have a strong foothold in our video platform. Have you tried Video Connect for some of these movement classes, Robin?
No, I haven't, but I know about it, so I'll check that out.
Excellent. Yeah, and just for any veteran on the call, the VA has a really lovely program called Digital Divide. If for some reason internet access or access to a device with a camera that's front-facing is a barrier to accessing these services, you can talk to any provider at the VA and we can get you connected with a VA-provided tablet, which really just makes accessing not only whole health services, but all kinds of appointments more comfortable and just a lower barrier to entry. So something to think about if that's useful to anybody. It's called Digital Divide.
Okay, so I've got an appointment coming up tomorrow, so I can ask my provider. It's a specialty clinic, podiatry, so I can ask the podiatrist about getting a tablet.
Absolutely. If you are planning to do video visits, you could talk to them about that. If they're not sure, they'll connect you with a social worker or someone. But we're all quite educated on this initiative at the VA, so just bring it up. I think things are going to go well.
Okay, then. Thanks a lot. I appreciate your help.
Absolutely.
All right. Next up, we have Chandra from Madison. Chandra, what question do you have for us?
Hi. I was just wondering how do you sign up for those classes classes to protect yourself?
Oh, yeah, the self-defense classes?
Yeah.
Yes, good question. So all you have to do is RSVP to Shanna, and her phone number again is 608-256-1901, extension 18422. And then she'll connect you with all that information that you need and sign you up.
Okay, and then I just wanted to peer off what Barbara said out of Baraboo. I had some of the same experiences here in Madison, and honestly, not going a whole lot into it. I buried 2 kids in 2000, came back a wreck, came back all emotionally destroyed, and I got to the point where I just did it on my own because the VA was actually hurting me versus helping me, and they never did help me through that, by the way, up here in mental health in Madison. So I just gave up and did it on my own. And the other thing that I want to add, too, is, like Barbara, myself, I lost my primary in women's health. Dear lady. Dear, I loved her. I lost her. And when I lost her, it took them forever to get me a primary doctor. It's like they changed my doctors like I changed my underwear. And I never knew who my doctor was or who to go to for help.
Oh, I'm so sorry to hear about that experience, and we've definitely improved from then. So we have many good providers, mental health providers. We do have peer support specialists here to help you, too. They can definitely help you, hook you up with other types of care, or even connect you with other veterans so you can get kind of that, both that social and emotional support. So definitely please reach out to us again, because we're definitely happy to help, and we want to do a better job. And primary care, sadly, sometimes there is flux with providers. You know, you gain and lose some, and so we hope we can definitely improve our communication with that, too. I know we are sending letters and that when there are changes. So, and always feel free to reach out to me if you do need anything. I'm the Women Veteran Program Manager, so I can be reached at 608-256-1901, extension 10907.
Okay. And like I said, I have found another doctor through the clinic at West, who I love. And also I have found a peer support that has been through my side through a lot of this that I've actually had to lean on more times than I can remember because I haven't had any other support through the DA.
That is excellent to hear. Excellent to hear that, you know, we've got some more help for you. So, and we definitely want to keep that going. So thank you. All right, Emily, we have you up next from Madison. What question do you have for us?
Hi, can you hear me?
Yes, we can.
I hope. Okay. I have a couple questions. So, I was wondering if we're able to get a women's health coordinator assigned to us. Is my first question. That being said, I also have asked for a fertility consult before, or I asked for fertility care. I'm 34 and I'm immunocompromised and I have some autoimmune disorders, and I was asking about IVF and eggs being frozen. I just feel like as a young female veteran, I feel like it kind of gets thrown to the side, and I really would like, for the gynecology needs to be helped there. I struggled with something in gynecology that was gynecology related for 8 months, which I felt was really unnecessary because no one was following through with the care plan. So if I have like a women's health coordinator, I feel like that would be really helpful, or someone just like on my side.
Hi, Emily. My name is Ann. I'm the Women's Health Care Specialist, and I can help you with some of your concerns that you have going forward as far as figuring out who's on your team and who can be in your corner as far as getting that help. My VA mobile number is 608-509-1431, and that is only on during office hours. Again, my VA mobile number is 608-509-1431, and if you would like, I can to give me a call. I can help you navigate some of those questions that you've asked.
Yeah, that would be awesome, because I also have like hormonal stuff that I would like, and perimenopause stuff questions that I just want help with.
Yeah, we can totally talk about all of those concerns that you're having and figure out a plan for you talking to your primary care provider about all of those concerns.
Cool. I will call tomorrow. Thank you for hearing me.
All right, sounds good.
And this is Dr. Weicker with Women's Health. I just wanted to add about the fertility care. We do have a fertility care coordinator, Tanya Dallas, who can help guide you with what benefits are available to you and kind of help coordinate that care. Her number is 608-256-1901, extension 18584. And if you want to reach out to her, she can help you understand your benefits.
Okay, awesome. I appreciate it. Thank you so much.
Thank you. All right, we have one more before we go back into some more updates. We have Teresa from Rockton. Teresa, what question do you have for us?
Yes. My question is regarding community care. I've been referred to community care for my eyes, and I was told that I could get my care through the community, but I'm not allowed to get my glasses through them. So how do I get my glasses now?
Hi, Teresa. Thanks so much for your question. My name is Ellen Decker, and I am from social work. And you're absolutely right that a lot of our veterans are referred through the community care program for a regular eye exam, but that the VA eyeglass benefit, you have to get those eyeglasses through the VA. And, you know, a lot of our veterans are eligible for eyeglasses through the VA as a part of their benefits package, but not every veteran is. Veterans who are 10% service-connected or have a 10% VA disability rating or higher are eligible, and there are some other criteria that make folks eligible as well.
I've gotten my glasses. I'm sorry to cut you off. I was just going to let you know that I've gotten my glasses previously through the VA, so I know I qualify for them.
Perfect.
I just want to know how I can get them.
How you do it. Great question. So what I would suggest is reaching out to the Madison VA Eye Clinic. And their phone number is 608-280-7034 is their direct dial. And that number for the eye clinic, again, is 608-280-7034. And someone there can kind of talk you through the options. Usually what they like to try to do is have you come to the Madison VA for like an eye tech appointment just to be fitted and make sure they have the right frames and that they're going to fit well and all of that, and bring a copy of the prescription that you get from your community care eye provider, and then they can get those glasses ordered for you that way. If there were some major barriers to getting up to the Madison Eye Clinic, they might be, and if you've gotten glasses before, sometimes they can work with you on other options. But the thing to do would be to reach out to the Madison Eye Clinic and basically use that copy of the eyeglasses prescription from the community care provider and work through our eye clinic to then get those prescription eyeglasses.
Okay. Thank you.
Thanks so much.
Thank you, everyone. Such great questions. Our next update is from Dr. Maddie Weicker on GLP-1 medications.
Hi. GLP-1 medications are an exciting option for people living with type 2 diabetes and those looking to manage their weight. GLP-1 stands for glucagon-like peptide 1, which is a natural hormone in your body. GLP-1 medications, or GLP-1 receptor agonists, work by mimicking this hormone to help your body regulate blood sugar, increase feelings of fullness, and slow down how quickly food leaves your stomach. If you have type 2 diabetes, GLP-1s can help lower your blood sugar levels and may even reduce the risk of heart disease. For patients who struggle with obesity or have trouble managing their weight, these medications can also help with weight loss when used together with healthy lifestyle changes like balanced eating and regular physical activity. GLP-1 medications are usually given as a once-weekly injection, but some versions are daily injections or even in pill form. The VA currently only offers injectable versions. They are not insulin and typically have a lower risk of causing low blood sugar when compared to other diabetes medications. Like all medications, there can be side effects, most commonly nausea or stomach upset, which may improve over time. It is important to talk with your healthcare team to see if GLP-1s are right for you. They can help create a treatment plan tailored to your needs and overall health. Remember, GLP-1 medications work best as a part of a bigger plan that includes nutrition, physical activity, and regular follow-up care. At this time, you do need to participate and move to qualify for GLP-1s for weight loss. If you have any other questions or want to know more, don't hesitate to reach out to your VA provider. Your health is our priority.
Thank you, Maddie. Our next speaker is Jennifer John Cox, our Suicide Prevention Coordinator.
Hello. Preventing veteran suicide is a top clinical priority for the VA. One of the ways we can do this is by increasing the time and distance between a person in suicidal crisis and their access to lethal means. The VA Keep It Secure program promotes awareness about the simple steps you can take to protect yourself and your family. You can find information such as how to secure firearms, safe medication storage, as well as support for veterans and families who are experiencing a suicidal crisis. For more information, you can find more information at www.keepitsecure.net. That address again is www.keepitsecure.net. In addition, we provide cable gun locks for veterans and the community free of charge. If you are interested in cable gun locks, ask the clinic next time you're in, or you can request them through your primary care team. Did you know you can download the VA Safety Plan app on your mobile device? Go to the App Store on your mobile device and search for VA Safety Plan. Download the app that has an upside-down house or pentagon shape in purple with an S through it. This app allows you to create your own safety plan, starting with recognizing your own warning signs, identifying your ways to cope. You can add your family and friends as well, to call as well. Unlike the paper copy safety plan, this app is not only mobile, but you can access the tools function that you can utilize in times of stress or crisis, such as ambient sounds and breathing exercises. Again, you can find this resource in the App Store on your mobile phone or tablet by searching for VA Safety Plan. Because financial well-being is related to better mental health and lower suicide risk, the National Veterans Financial Resource Center was created to provide a one-stop website to find money resources, boost financial literacy, and help veterans navigate their financial journey. You can find this resource at www.mirec.gov/MIREC/FINVET. But you can also find this if you search on your internet for FINVET, and just make sure that you click on a website that is va.gov. As always, veterans can reach out to the Veterans Crisis Line for free, confidential support 24/7. You can reach the Veterans Crisis Line by calling 988, press 1, texting 838-255, or by using the chat feature online at the veteranscrisisline.net/chat. Again, that information is 988, press 1, texting 838-255, or by using the chat feature online at veteranscrisisline.net.
Thank you, Jennifer. Our final update is on our Sister a Sister program. Sister a Sister is a special support program for women veterans. Our women volunteers are here to help, from walking with you from the clinic or hospital entrance to your appointment, to staying with you during the visit if you'd like added comfort or support. We're currently looking for women veterans who want to volunteer as Sister of Sisters. If you're interested, please leave a message after this call or contact Tanya Salas, our Sister of Sister coordinator, at 608-256-1901, extension 18584. Again, that phone number is 608-256-1901, extension 18584. If you'd like to receive Sister of Sister support for an upcoming appointment, call 608-256-1901, extension 13440. Please leave your name, last four of your Social Security number, phone number, and the date, time, and location of your appointment. We ask for at least 7 days' notice so we can ensure a volunteer is available. Again, that phone number is 608-256-1901, extension 13440. Let's now go back to all of your questions. Let's take a few more questions. So first up, we have Valerie from Beloit. Valerie, what questions do you have for us tonight?
Hello. I wanted to ask for the MOVE program, does that address people with hypertension and prediabetes, or would I need to get involved in the whole health program for that?
Hi, this is Maddie Weicker with Women's Health, and thank you for your question. I would definitely recommend getting involved with the MOVE program. They are absolutely helpful in guiding people with diabetes or prediabetes and high blood pressure. They focus on nutrition and exercise and a healthy lifestyle, all of which have been shown benefits in helping people with hypertension and diabetes. If you would also like to get involved with whole health, I think that would be another great option to identify your overall health goals and to see if there's other programs that could be of benefit with you and your lifestyle.
Yeah, I'll just, this is Sarah with Whole Health. Just to kind of add, you're making a plan with your primary care team, and MOVE is a great program. I think we said today 2 decades of success within the VA. And then in Whole Health, we have health and wellness coaches, for example. So if you in the MOVE program are learning, here are lifestyle changes I can make to be empowered with respect to managing these conditions, a health and wellness coach is a really powerful partner who helps you break those lifestyle changes down into accomplishable goals. And so now you're just creating this cycle of wellness related to where you want to be.
Yes. Okay. Thank you so much.
Excellent. Next, we have Pamela from Madison. Pamela, what question do you have for us?
I just want to know if you had a list of other urgent cares a person can go to, because last winter, it was 2 months ago, I was having problems with my I called the nurses down at urgent care. The weather was miserable. I asked if I could go to the urgent care that's next door to me because I live on High Point Road, and she said yes. So I went over there so I wouldn't have to go driving everywhere. And now I have a $300 bill. And I was said that urgent care, the SSM urgent care there, is not on the list, but that's where I go get my eye checked up. So what gives?
Hi, Pamela. My name is Jody Barnett, and I work with the supervisor in the Health Administration Department, and I'm so sorry to hear that you've got a financial burden resulting in some misinformation or miscommunication, but let me give you a secret, and here's what I use from one female veteran who gets care at Madison to another. What you can do is go to va.gov, and the search engine, I want you to type in the emergency care. The 2 words, emergency care in the search engine. It's going to give you a couple different options. It's going to walk you through either virtual care, urgent care, emergency room, or 911. And it's a great website because it'll help you either find your local number where you're at, you can chat with a nurse online, or get in touch with our tele-emergency care immediately. Then you can also access a list of our providers within our network here in the Vision area. And I want to make sure that you have that information. So go to va.gov, and the search engine, type in emergency care.
Okay, but the one point I would like to add to this is that do the urgent care nurses know that list? Because
it's an ever-changing list, unfortunately. Sometimes, the list could change tonight after we hang up this phone call. And so it's hard to stay on top of that information 24/7. So the best thing for us to do is I want you to go ahead and do that. And then you're going to have to call the VA after you reach out to urgent care. But what we're going to do, instead of taking so much time tonight, Pamela, is we're going to make sure we have your phone number and a way to get a hold of you when we finish today, and we will make sure we connect you on how to do that. And I will hook you up with all the websites that you need, all the links, and a POC. That way you have it all right at your fingertips, and you'll even have my personal email address so you can get a hold of somebody right here in the hospital in the future.
Okay.
Okay, Pamela?
Yes, because I don't want to see anybody else have to go through this.
I completely understand, and thank you for your service and being on the call this evening.
Yes, and don't forget to leave a voicemail at the end of the call with your contact information so we can definitely connect with you. All right, next up we have Sandy from Prairie du Sac. Sandy, what question do you have for us tonight?
Hi. First of all, thank you for doing this. I'm new to the VA this year, and I've been nothing but good stories. Everything has been going great for us. I just have a couple of quick questions about the whole health program. I am involved in it, and I did take the yoga class last week, and I did sit through the observation of the GeroFit last Friday. Love them both. Going to do both. Unfortunately, I don't know how to connect for each session. I thought I would be getting an email link each week for the yoga at 5 o'clock. They're all virtual classes. And then the GeroFit, they said you could pick and choose what time frame you wanted to come and what days you want to come. But I think you guys already know the time frame, but it's Monday through Friday, and there's like 7:30, 8:30, 9:30, 10:30 classes. And I just want to know how I get into those classes virtually every time. How do I get to that link? Because I didn't get an email for any of them, other than last week to attend the first yoga and the first GeroFit. I haven't gotten any links this week to get into the classes. So am I supposed to be going to like my VA Health or?
Yeah, Sandy, Sarah Rogers with Whole Health. Great question. After we speak, do leave your name and phone number, because what I would expect for the yoga class is you would get an email every day before the class. And so if the class has met twice but you didn't get an email in front of both classes, then that makes me worry that we did hit a bump. So reach out about that. The GeroFit, I believe they have a static link, but if you've done an observation, you might be in a process where they're getting you into the program. So I think your answers are going to be personal to where you are right now. So let's get your information, and I will personally follow up this week.
Okay, I guess I should mention, I didn't think of it, but they did send me an email with a questionnaire, and I did fill that out, but that was just this morning. So that you may be onto something there. Maybe why I haven't heard anything.
Was that for GeroFit?
That was for GeroFit. For yoga, I attended the yoga class last week. I was supposed to get a notification like 30 minutes before the class, so around 4:30. I didn't get it until like 10 after 5, and I thought it was because I was new to the class and it was a quick oversight, but that they remedied it. God, I can't even talk. Anyways, but I didn't get one tonight either. I wasn't going to attend tonight because I wanted to be available for this call, but I did not get the link to sign in for the yoga class tonight.
Okay, so I think it sounds like the GeroFit process is running as we would expect. It sounds like that's flowing, and I will have to do a little digging on what's going on with the yoga for you, so just leave your phone number, please.
You bet. Thank you so much. And again, thanks for all you guys do. I've really had positive experiences so far.
Wonderful to hear.
All right, excellent. All right, next up we have Bonnie from South Wayne. Bonnie, what question do you have for us?
Hi. So I got a question about, it's more pharmacy. When your refills, as you deplete them and it goes to zero, sometimes it's very difficult to, even through like secure message, depending on the resident or the doctor or the provider you have, to get refills. So, and I don't know, out of all of the pharmacy issues, I think the pharmacy program is great. I mean, you can just go in, refill online. I absolutely love the program, except for the zero refill. And I was wondering if there was a way, and this is probably a national question because I think that's a computer thing, whatever. But is there any way that once you hit zero refills that instant mail, email or text or something would go to the provider and say, hey, this person has zero refills, please refill, if they approve of that. Because they would know if they approve of it because they would have just seen us or seen us within the year or whatever. So that's the only glitch I see in the whole pharmacy thing, because it can take up to 3 weeks sometimes to get a zero refill refilled. going through secure message or, and it just could be, the doctor's out or whatever. I just think it would be easier if it was just automated, that zero refill. And I just want to say, honestly, this is the best hospital in the world. I've been to other hospitals as well on the economy, the ones that are insured and all that kind of stuff. And there is no way they hold a candle to our VA. And I just want to thank you all for everything you do, for your innovation. I'm just very lucky woman to have the Madison VA, and I want to thank you.
Thank you, Bonnie, very much for your question and for that positive feedback. We all really appreciate hearing that you're having such a great experience. We certainly enjoy being a part of your care. My name is Rachel. I'm one of the pharmacists that works here through the VA. It's a great suggestion about the process for getting medications renewed. Unfortunately, there isn't a super straightforward or seamless process for medication renewals similar to what you described at this time. My suggestion might be to keep an eye out on your prescriptions, and when you notice that you're down to no refills on a prescription or when you filled something for the last time, I would recommend reaching out at that time to your provider to request that medication be renewed. Hopefully that way we'll see fewer care delays. I acknowledge there could be some limitations to and how quickly those renewals can be processed and prescriptions mailed, but best practice at this time is likely for you to monitor for your refill status and request renewals as soon as you notice that one is at zero.
Yeah, I mean, I do that right now, but it just seems like it would be so much easier if it was automated. And how do you make that suggestion at the national level? I guess that's kind of where I want to go with it. Because I think it's a national computer issue.
Bonnie, that's a great question. Transparently, I am not certain how you could make that suggestion more broadly. If you would be willing to leave your contact information, I'm certainly happy to connect with some additional staff and can provide you with an avenue to provide that feedback.
Okay. Thank you. And thank you all for everything you do for me. You're all amazing.
Thank you, Bonnie. All right, we have Sarah next from Rockford. Sarah, what question do you have for us?
Hi, I'm Sarah Hormig, and I'm a patient at I'm actually a patient at the Janesville VA, but I live in the Rockford area. And so I just want two things. I want to branch off with the last question. I have plastic surgery at the VA, and I agree with her 100%. The care at the hospital and with the OR team and pre-op and recovery was A+. I've had surgeries before, and I would have to say that I would say that the VA in Madison is one of the best in the country. So that wasn't my question. My question is that we have quite a backlog for nutritional consults having to do with the MOVE program and weight loss medications. Consult was placed for me in March, and I can't talk to a provider on the phone until June.
Sarah, my name is Karen Bulke. I am a registered nurse here at the Madison VA. I also work in health promotion and disease prevention. Thank you so much for your call today. MOVE has become very popular with the advent of a lot of really effective weight loss medications. It's unfortunate that everybody wants to try to get in at the same time. However, what I would recommend for you is that you can speak to a dietitian and get individual appointments if you would like to start working in that route before maybe you could get into the MOVE class. There's also a MOVE app where you could go online, go to the VA App Store, and download the Move app and get some nutrition information, some activity information for yourself, and start working through the program that way so that you're a little bit more well educated when it comes time to that group. And I, as somebody who has been teaching at the Move, in the Move classes for a number of years, I think what veterans really like about the Move program is that group aspect. They're teaching each other as much as they're learning from the instructor for that particular week. They show support and encourage each other, and that's what helps to make this program really effective. Does that help answer your question?
No. I am a nurse practitioner with the VA. I'm a primary care provider with the VA. I just happen to be a woman's veteran that also gets care. So I do understand the pathophysiology that's going on. I cannot speak to the nutritionist until June. That is the nearest appointment, and then the consult was placed in March. So that's a problem. I'm just pointing out a problem that there's this big backlog, even though it's a great program, and I do understand it. And my conversation will probably be short because I have that education, but as a woman veteran, as a patient, I am following the right protocols and not trying to circumvent the system as a provider. So my concern is when I put Move program consults in for my patients, I know they're going to wait months.
Sarah, this is Carol Bullock again. I appreciate that from your perspective as a woman veteran as well as a provider. I definitely, please leave your information, although I will know how to reach out to you, and I will have the nutrition team follow up with you and maybe have some more understanding about the current situation. However, it is it's a very difficult thing to try to add more staff or more classes and things. And I will tell you that what we have done to help support that effort is that we used to offer classes every other month. We now offer them monthly, and we increased the number of veterans in each class. So we are trying everything we can think of, but if you've got some other suggestions, we are open to that. Thank you, Sarah, for your service as a veteran and your service to the VA.
Thank you, Sarah, and thank you, everyone, for the wonderful questions tonight. Unfortunately, this is all the time we have for questions today. If we didn't get to your question, please stay on the line because in just a moment you'll have the chance to leave a voicemail with your questions, comments, or feedback. We plan to get back to you with a response within the next several weeks. Thank you for joining our telephone town hall. Have a great evening.